Welcome. This is Dr. Bob Arnold, and I want to welcome you public health nurses to the PHN 2008 conference. This breakout session will focus on ways that you can do your job of public health pediatric vision screening with more ease and more specificity toward what we're looking for, particularly the younger children with conditions that can lead to amblyopia, which when treated early can result in much better vision. We also have some additional aids to help you with later testing of acuity in children that we'll cover a little bit later. But first, let's focus on photoscreening. Photoscreening is a technique that we've been using in Alaska since 1996 as a part of the Alaska Blind Child Discovery Program. The Alaska Blind Child Discovery Program started with the MTI photoscreener. And this is a batch of some of the leftover photo screens that have been done in the Valley by the Valley schools. These are batches of photo screens that include these black and white Polaroid photographs of children. The image quality of these photo screens has to be read by someone experienced with reading photo screens. Hidden within the images of the red reflexes of these children may be conditions such as high farsightedness or unequal farsightedness or astigmatism that can lead to amblyopia or deficient learning of brain vision. Kids with high farsightedness, unequal farsightedness, or astigmatism can be treated with glasses early, and that can result with much better brain vision in the long run. The Polaroid for the MTI photo screener is running out, and therefore we've switched more toward digital photo screening, initially with commercial cameras, and now more recently with a device that's called the PlusOptix that you're going to get a chance to see today. The Alaska Lions Club, District 49A Lions Club, have raised a significant amount of money with Alaska Blind Child Discovery to purchase for the state of Alaska 13 PlusOptix screeners, which sell for $10,500 each, combined with computers that will be made available to those public health nurses that find this technology valuable. The PlusOptix S04 screener comes in a nice aluminum case like this. It hooks to a computer by USB and FireWire and to a printer, and it looks something like this, a little bit like a radar gun. So that's the PlusOptix S04. Alaska also has the very first German-made American PlusOptix S08. And that's this one right here that was purchased by donors in honor of Julie Smith, who is an early infant learning specialist who died recently. The PlusOptix S08 works with similar computer technology. It looks like this, and you're going to get to see this demonstrated. The PlusOptix uses infrared, so there's no obvious flash. And the PlusOptix images are interpreted by the computer to yield the spherical and cylinder refractive error, pupil size, and an estimate of ocular alignment, all of which are risk factors for amblyopia. The significant advantages in photo screening and using the PlusOptix, and the reason that Alaska Blind Child Discovery is moving to that, is that you as a public health nurse will have the chance to set this up in a community, get consent as you so desire, and line these up with the children. If you decrease the luminance and the distraction, you should be able to get images from this in a matter of seconds, at least less than 30 seconds, with results obtained by the computer and printed off on a page of paper or on a sticker And the computer is able to, by user-definable methods, have thresholds of cutoff of referral or pass. Those 1 out of 20 children who need referral, you will be able to work with the parents on site to start setting up their referral for a confirmatory pediatric eye exam after that. In the communities that you serve, you'll also be able to follow up then those younger children who have their eye exam to find out whether or not they had their exam, whether they got their glasses, and whether they need further treatment such as patching or possible eye surgery to reduce their risk of getting amblyopia. The PlusOptix works on children very, very young. The attentive children, more than 6 months, so let's say 9 months of age up through kindergarten, are the target age group that we'd like to use this for. After kindergarten, children usually are getting more organized and they're in more order, so that acuity testing to find out how well they eventually see may in addition be useful. The PlusOptix photoscreening system works very, very well on children with limited developmental delays, so that you can get an assessment of the degree to which their eyes are focusing and lining up, even if they can't respond verbally. So again, the Alaska Blind Child Discovery and the District 49 A and B Lions Club would love to partner with Alaska's public health nurses to make this state-of-the-art technology available to Alaskans, not just in urban areas, but also in remote areas of Alaska, such as the bush. Some of that part of Alaska, as you know, only gets its health care through the work of the public health nurses. Back in 1996, public health nurses starting in Seward, Valdez, and in the Bristol Bay area started using MTI photoscreeners, and those areas have still become areas with the highest penetrance of pediatric vision screening perhaps in the world. We look forward to working with Alaska's public health nurses to make this newer and simpler technology available to all Alaskans. Please feel free to review our website at www.abcd-vision.org or give us a call at Ophthalmic Associates at 907-276-1617 or statewide 800-270-1617. Thanks.